DNA, short for deoxyribonucleic acid, is a long and complex molecule that contains all of the information necessary for making all the proteins in our body. It is specific to each individual, being our own unique genetic code. The proteins in our body that are formed from our DNA are responsible for the absorption, distribution, metabolism, and excretion of drugs. As we all have our own set of genes, we are all genetically different, and therefore our bodies also differ in how we react to medicines. There are actually several factors that influence how the body reacts to a drug, such as age, environmental factors, diet, and our DNA. However, most of the time, the doctor will prescribe a new medicine in a standard dose, without taking into account the genetic code of the patient. This standard dose works well for most individuals, but in others, this dose can cause unwanted side effects, or it may not work at all. Side effects are the 6th leading cause of death, causing up to 100,000 deaths annually in the United States alone. Side effects are a real problem. But what does DNA have to do with this? During the process of making proteins from DNA, mutations can occur, which can lead to the formation of a non-functional protein. If proteins are responsible for how a medicine enters our body, how it is distributed to the place where it has to exert its effect, how it is broken down, and how it is excreted afterwards, then if one of these proteins is not working properly, it can influence the response to a medication. For example, ABCB1 is a gene that encodes a protein that has a transport function in the blood-brain barrier. The SLCO1B1 gene is another example of a gene that encodes a protein with a transport function, and is responsible for transporting medicines to the liver. The COMT gene breaks down dopamine in the prefrontal cortex, and when it has a mutation called MET, this protein is not functional and dopamine levels are higher, and therefore the person remains in a state of alert. The 3 genes are discussed in more detail in the full version of this video. But how do you know which variations are present in each patient? We have the test that can help you understand your patient's body and your patient's genes. Just buy the tests for your practice online and get started. Now you can provide your patients with a swab and an instruction manual to collect a saliva sample. The sample is sent back to us with the return envelope. When it is sent to the lab, it will be processed and analyzed. Now, the patient only needs to wait. The results will become available in his or her account. Upon receipt of the results, the patient will get a report that is specifically written for patients and contains the full results and explanations per gene. The healthcare provider gets a report that is specifically developed with a more scientific approach to give all the background information to help the healthcare provider and patient decide what will be the best choice of medicine and dose, taking into account their unique genetic code. Start with pharmacogenetic testing in your practice and register your first test kits on meamedicapro.com.